This is Retirement Keys with Anthony Kangemi from Crescent City Retirement Group. When a part of your financial strategy is out of tune, your long-term goals, your retirement savings, and your legacy can all suffer. With many years of experience in the financial industry, Anthony provides his clients and prospects with the information they need regarding Social Security, retirement income planning, wealth management, and much more. Listen in as we address your financial concerns and provide helpful solutions to put you on the path to achieving your retirement goals. And now, here is Retirement Keys with your host, Anthony Kangemi.
All right, hello. This is Anthony Kangemi with Retirement Keys. Thank you so much for joining us this morning. We really hope you're enjoying the show. We try to bring value to you every Sunday morning on retirement planning and all the different facets of retirement planning. And so we hope the show has been helpful for you. So we appreciate you joining us. We've got Tony, our fabulous co-host, with us this morning, as we do every Sunday. Tony, thank you so much for being here with us.
Well, it's great to be here with you, Anthony. I really enjoy the show each week. And we always cover some amazing topics. And I know that you cover a lot of financial topics, but, you know, a lot has been happening. I mean, you know, people are always worried about, I think the four main things you always talk about are tax increases, inflation increases, market volatility, and, of course, healthcare costs. These are the four major roadblocks or concerns people have when it comes to their retirement planning or their finances. So, I know today you wanted to talk a bit about the healthcare side and how that's going to be covered in retirement, correct?
Absolutely, Tony. So as you know, our five keys that we think are so important as it relates to retirement planning, as the estate and legacy plan, of course, healthcare, which we'll talk more about today, investments, as you mentioned earlier, with inflation and market volatility, of course, income planning in retirement, and taxes, being tax efficient. So we think those are really the five pillars or the five keys that have to be addressed in any retirement plan. And we really feel that you can accomplish a stress-free retirement by just covering your bases. And so, yes, this morning we want to talk a little more in depth about Medicare and healthcare planning and really drill down a little bit because, of course, that's a very important topic. I mean, your healthcare, when we do our workshops, Tony, we always start the workshop off by asking, the people in the audience what, people might concern themselves with or what people or, I hate to use the word worry about, but what people concern themselves with as it relates to retirement planning or retiring. And invariably, healthcare and, will come up. People say, well, we want to make sure that we have what we need as it relates to our health care. If we get sick or if we need additional help, where's that money going to come from? What's the best place? What are the options? So we want to talk more today about those things, Tony, the healthcare portion of a sound retirement plan.
Well, there you go. And that's healthcare plays a big role in that because of its cost, obviously. And you can get deep in the weeds here. And I know that we want to talk some about Medicare and how that can how we can navigate those murky waters. I know this is something that your office helps your clients with, right?
It is, Tony. So, for our clients that retire prior to age 65, we have to bridge the gap with their health insurance unless their, employer allows them to stay on the group plan. Then invariably we will in most cases, that'll be a better choice. But then once they get to Medicare at age 65, then, of course, they have those options for Medicare. And yes, we help them make those selections. We talk about Medicare and how it works and the various options. And then, of course, long-term care also is part of that healthcare discussion, Tony.
Right. And so regarding healthcare, where would you like to begin? I mean, we all need Medicare. Everybody or most people will get Medicare when they turn 65, obviously. And they need to be aware, though, Medicare still costs money, and it doesn't cover everything, right?
That's right, Tony. So traditional Medicare has several, and it's kind of like alphabet soup. I hate to say it, but there's Part A, there's Part B, and then there is Part D. And so on traditional Medicare or original Medicare, you have Part A, which is your hospitals or inpatient. And then Part B is your medical costs or outpatient costs. Part B is pretty robust. I mean, it's outpatient surgeries, it's ambulance service, it's special tests like MRIs, CAT scans, blood work. It's everything except the inpatient hospital part to Medicare. So you have these two parts, Tony. Part A, which is inpatient, and then, of course, Part B, which is everything else. And so when people get to 65, they're going to be joining Part A and B of Medicare, and that's going to handle their medical part of it. Now, of course, let me just say that they may have group insurance. They may still be employed. So they may not be joining Part B at the time they turn 65. It depends on if they have insurance from their employer. So all of this has to be weighed out, Tony, as far as how you're going to proceed when you turn 65. But in this example, we're going to go with the example that, hey, I'm 64 years old, I'm still working, and I'm going to be retiring at 65. And my group insurance with my employer, doesn't keep the retirees on. So I don't have any option there with my employer. Now, again, with that said, and not being, overly redundant here, if there are options with the employer, then of course we want to explore those options, because a lot of times they're very good options. But nevertheless, in this example, we're going to assume that there is no options from the current employer, and once this participant retires, they're going to be on Medicare. And so at that point, yes, Tony, there are, Part A and Part B. Then there's a Part C, which is called Medicare Advantage. And then there's Part D for the prescription drugs. We have a really a very well put together 30-minute Medicare basics presentation for baby boomers that need to know about what their options are as it relates to Medicare and the various options. And we want to make sure that our listening audience has that opportunity to see that presentation if Medicare and joining Medicare is part of the agenda for retiring.
Right. Yeah, and that's huge. It has to be a big part of your plan, because healthcare costs, as you've mentioned before, Anthony, are such a huge part of retirement and retirement planning. The costs have gone up and up. So how do you deal with that? Well, the first way is understanding Medicare, what it covers, what it doesn't, how it works, and working with a financial services professional that incorporates that into their planning like you do for your clients. And I think that is huge and something our listeners need to understand. And I don't care if you're 50 years old or you're 70 years old, now is the time. The sooner the better, obviously. But there are constant changes to Medicare and the different options of covering healthcare costs in retirement. It's not just Medicare or nothing, and you're done, right?
That's right, Tony. And you bring up the whole, what does Medicare cover and what doesn't it cover? And and as I say, I mean, I will go on record by saying I am a big fan of the Medicare program, and I think that it's just just a wonderful a benefit to retirees and people that are qualify for Medicare. But back to your point about what Medicare covers and then what it doesn't cover. I have a kind of a brief a short list here, but surprisingly, some of the things that Medicare doesn't cover, and I'd like to read them off. For instance, long-term care. Medicare doesn't cover long-term care. So once somebody gets discharged from the hospital and they need to recover in a long-term care facility, Medicare has very little in the skilled section where they will cover some, but the traditional long-term care where people need to recover for, let's say months or even years, and they're in some type of long-term care facility or assisted living, or they need to stay home and recover. Medicare pays very little for that. Care delivered outside of the United States. If you're traveling outside of the United States, Medicare doesn't cover for that. Some policies have foreign travel benefits, but Medicare doesn't cover outside of the U.S. And here's the three big ones, Tony, that I would say is unfortunate, and we run into, time and time again, is these three here: dental, vision, and hearing aids. Now I would love for dental, vision, and hearing aids to be part of the, Medicare, original Medicare AB program, but it's not. It's not. So Medicare doesn't cover that. Cosmetic surgery. So if, Medicare doesn't feel it's medically necessary, which is kind of the key there, they don't cover cosmetic surgery. Acupuncture and other alternative care. Acupuncture, and I will say there, my dad was a recipient of acupuncture, which
Really?
oh, wow. And boy, did it help.
I have heard that it really can help. It just shocks me.
Well, he was in a situation, Tony, where he got to the point. He was at St. Francis Villa. He was at a beautiful assisted living facility, and he got to the point where he almost couldn't walk. I mean, we thought it was spinal stenosis. He was having these these back pain. And finally, after, neurologists and MRIs my sister and I tried to get help for him, and nobody could really pinpoint it. We end up with a doctor behind East Jefferson Hospital out here in Metairie off of Houma Boulevard, and did acupuncture for 3 weeks with my dad, little small needles in the back, 3 sessions a week for almost 3 weeks, very short time, about 30 minutes. I think we were in and out. And I mean, at the end of the 3rd week, he was walking, with literally no pain. So acupuncture can be a great, but of course, Medicare doesn't pay for that. Amounts over Medicare approved amounts. So Medicare approves a certain amount. So the point here, Tony, is there are things that Medicare does very well and things that are not covered. And so organizing your health care planning where you have your ducks in a row, bases covered, to have a robust medical plan, healthcare strategy, and retirement is key to having, that stress-free retirement, Tony, that we talk about.
Well, yeah, and that's what it's all about. And understanding that this is one of the big keys to a successful retirement that you're always talking about, but knowing the things it doesn't cover. And what I find it really, I don't know what the term I should use is, maddening or frustrating, is that Medicare is really, it's for seniors, medical expenses. And what are three of the biggest things that medical expenses seniors have, or common things? Hearing, vision, and dental. And I mean, when you get older, I mean, those are the first things to go, right? I mean, your teeth end up having problems, your vision gets worse, and your hearing gets worse. And Medicare doesn't cover any of those, does it?
Unfortunately, Tony. Now, there's these discount plans and dental plan, vision plans, but to say these are really robust, coverage. And that's why I said earlier about folks that have medical insurance and group insurance from their employer. A lot of times, Tony, when people are retiring, if the company group that they've been on for years and years, let's say, will allow for the participant to maintain the group insurance, we do a pretty, in-depth analysis on what you're going to have if you leave the group, or what you would have, just a side-by-side comparison, Tony, because a lot of these company group plans that do allow their retirees to stay on the group. You with me? A lot of times that's the thing to do, is to keep your group, because a lot of those benefits, like the dental and the vision and the hearing and all of this, is part of the group plan, but it may not, be part of your Medicare plan. So we just want to make sure, Tony, at the end of the day, that we understand all of our options, whether it's original Medicare we're going on Part A and B, whether it's a Medicare Advantage plan, which is Medicare Part C, whether it's the drug plan, which is Part D, or whether it's staying with the group that we've been with for many years, if they allow for that with their retirees. We just want to make sure that we've explored all of our options so we can make the best choice. Because at the end of the day, in most cases here, you get one chance to do it right. And then once you make your elections, a lot of times you can't go back, once so we just want to make sure we have all the options in front of us, and we know how we're going to proceed as it relates to our healthcare planning.
Right. And I think that that's so important, Anthony. We should probably take a quick break, but before we do, let our listeners know how they can get a hold of you and that special offer you have.
Absolutely. So again, thank you all so much for joining us. Like I say, this is not a substitute for a full 30-minute presentation on Medicare basics. And then we have a deep dive, but we want to, make sure that you're well educated. And at the end of it, let's just make sure when you go to retire that you know all of the healthcare options that are available to you, and we can make sure that we proceed accordingly. Because let's face it, this is where you remain independent with the right healthcare planning. You can certainly protect assets with the right healthcare planning. So I'd encourage you, just make sure that we've got a good, thorough job in the way of healthcare planning when you're embarking on retirement. Thank you for joining us here. I do have a special offer. We're going to come back after the break, but take advantage of our special offer.
You've been listening to our shows and advice on getting your finances in order and creating a retirement income plan that will last. Now is the time to take advantage of our special offer. This is Anthony Kangemi of Crescent City Retirement Group, and we're now offering a complimentary gourmet dinner and retirement planning workshop, the 5 keys to a stress-free retirement. This is one workshop you won't want to miss. Call in the next 20 minutes for this no-cost offer. Seating is limited. Call Crescent City Retirement Group within the next 20 minutes at 504-828-2171. That number again is 504-828-2171.
And welcome back to Retirement Keys. I'm your co-host, Tony Shore, and I'm here with our host, Anthony Kangemi. Now, Anthony, we're talking about Medicare specifically today, but healthcare costs in general as well, because as we know, they just continually go up, and it's so important as we get older. That's a big part of your overall retirement income plan, has to be your healthcare costs. And some people, I think, are under the misconception that Medicare is going to take care of it and they don't have to worry. And Medicare is great. Like you said, Anthony, I am with you. I think Medicare is a wonderful program. It's very helpful, but you still have premiums and deductibles, and there's aspects and parts of Medicare that cost, and it doesn't cover everything. So, we talked about some of the things it doesn't cover. And of course, long-term care is one of the big ones, isn't it?
Yeah, Tony, long-term care is one of the big ones. I mean, that's, people get discharged from the hospital, and, we all might have had parents, grandparents, we've got Alzheimer's and dementia and Parkinson's and all sorts of things that'll put somebody in more of a long-term type of situation where they need care, either at home or in an assisted living facility or a nursing home. And they have these lower levels of care, Tony, these intermediate and custodial levels of care. So to give you an idea, CNAs, certified nursing aides, do things, and they call them activities of daily living, or for short, you hear the term ADLs, but it's feeding, dressing, bathing, toileting, transferring from the bed to the chair, and incontinence. So they got these 6 ADLs. And of course, if you're not able to, if I break my hip, Tony, and I might have trouble taking a bath or getting dressed without some type of assistance, right? So then I would not be able to perform, let's say, without assistance, 2 of the 6 activities of daily living. And that would constitute me to needing some type of additional care, right? Long-term care. So I don't need an RN or an LPN or I might need some physical therapy, but the day-to-day activities of daily living is part of long-term care, this intermediate and custodial level. And then they have the lower levels of care, like homemaker services, they call them, food, running errands, grocery shopping, and that sort of thing. So, just understanding that there are different levels of care and that Medicare does a great part in the medical plan, hospitals, doctors, and very little skilled care. But it's these other levels of care, Tony, with long-term care, whether you be home or in an assisted living facility, which frankly some of them are beautiful today. I mean, really nice.
Yeah.
I mean, but come a long way in that regard. But at home, people want to stay home. And let me say this. Even home care today has come a long way with the widening doors, building ramps, lowering, and then all the different, amenities that can be very inexpensively, in a lot of cases, put into the home to make things more accessible and, kind of handicap accessible. So I guess what I'm saying is long-term care has come a long way. The options have come a long way, but it does cost money. And so having a health care plan and knowing what all those options are and having it all coordinated is really what's key here. And I would like to say, Tony, before we jump off of this, is I'd like to just mention a word or two about, and I'm going to give you the acronym IRMA, IRMA, and it stands for Income Related Medicare Adjustment. And let me just say, Tony, when we talk about a holistic retirement plan and, estate planning and income and healthcare and taxes and investments and how we would say, well, all of that works together. And, it really does, Tony. And it's no different here because when you're drawing income in retirement, depending on the taxable portion of the income, you can get into these IRMA expenses where now Medicare Part B, which let's say would normally cost, and it's, the new premium for Medicare Part B this year, Tony, is $170.10, okay, per month for your Medicare to have Medicare Part B. That's the new, premium that people pay out of their Social Security check. But let me just say, with the IRMA, income-related Medicare adjustment, your premiums with the income, that's why you got to be careful about how you structure income, because with the IRMA expense, your Part B premium could be as high as $408 a month. So it can really get expensive if you're not careful with how you're structuring your income. So, I would just say, Tony, it's all pretty straightforward, but if you don't have an organized income plan and you don't know what the tax implications are and then how that might affect your Medicare premiums, you could, get yourself messed up, frankly.
Yeah, you really can. I mean, it's obviously a tricky situation, and there's so much to it. I mean, like you say, there's Medicare Advantage plans, there's supplemental, there's the Medicare Part D drug plans. You have to have some of those, and there's gaps in Medicare, and that's where the Medicare Advantage or Medicare supplemental plans come in. And I know this is something that, your clients, you work with them on, and it's all part of retirement planning that people need to be aware of. So I'm glad we're talking about it today. Now, we're almost out of time for today's show, Anthony. Why don't you let our listeners know how they can get a hold of you if they have any questions?
Absolutely. Well, so let me just say that we are extremely methodical in our firm. So all of these options and variations of how you would customize your healthcare planning and retirement, we have a very structured way of going about basically, Tony, just checking boxes to make sure that we've covered all our bases so you can enter into retirement with your healthcare strategy, and you know that we have done and you have done really your due diligence in making sure that you have the coverages that you need. As far as getting a hold of us, by all means, we have retirement workshops that we do every month. You can simply call our office to get more information. I'm happy to do the 30-minute Medicare basics for you if you want to learn more about Medicare. Our office number is 504-828-2171. And of course, that goes a long way in just having a well-designed, holistic retirement plan, which of course is really the goal, to have your bases covered so you can enter into retirement very confident that you've covered all your bases. So we thank you so much for joining us here today. I do have a special offer I'd like to make, and I hope you take advantage of it. Thank you so much.
Thank you for listening to Retirement Keys. Don't pay too much for taxes or retire without a sound income plan. For more information, please contact Anthony Congemi at Crescent City Retirement Group. Call 504-828-2171 or visit the website at crescentcityretirement.com. All matters discussed during this show are for informational purposes only. Each individual situation may vary, and the opinions expressed here may not apply to everyone. Materials presented are believed to be from reliable sources, and no representations can be made as to its accuracy. All ideas and information should be discussed in detail with one of our qualified representatives prior to implementation. Anthony Congemi and Crescent City Retirement Group are not affiliated with or endorsed by the Social Security Administration or any other government agency.